All right, good afternoon and welcome everybody. My name is Iman Ali. I served on the tech and logistics team for this conference and I am a junior at Tufts. I'm going to be introducing our speakers today, starting with Fatima. So Fatima Diankeh is the Learning and Development Manager for She Geeks Out, specializing in topics about racism, sexism, and the intersectionality of social identities. Fatima has facilitated conversations and conducted trainings with leaders and members of schools, organizations, and companies to help raise equity consciousness while also providing knowledge, tips, and strategies to help support institutional change. As a facilitator who believes in the power of sharing our stories, Fatima uses storytelling as a tool for individuals and groups to connect with one another. This form of facilitation has led Fatima to co-produce a short film and launch a photo story project about the experience of Black mothers in Boston and beyond. Fatima received her MPH in Community Assessment, Program Design, Implementation, and Evaluation, and Maternal and Child Health from BU School of Public Health, as well as earned her BA in Religious Studies and Anthro from St. Mary's College of Maryland. I'm now going to move to introduce Dr. Tariana Little, who is driven by science, storytelling, and social justice. Her work embodies what she calls intentional creativity for social change. She is the CEO and co-founder of M Vision Productions, a media boutique that helps forward-thinking organizations of all sizes and sectors convey how they are changing the world. Working at the intersections of media, public health, and business, she holds a Doctor of Public Health from the Harvard Chan School of Public Health, where she teaches about entrepreneurship and innovation, and also holds a Master of Science from UMass Boston. More importantly, she is proudly and unapologetically a queer, mixed race, Black/slash Afro-Caribbean Latinx woman, METCO graduate and first generation college student from a working class Dominican German background family, German immigrant family in Boston. Her life work is to expand opportunities for historically excluded communities in Boston and beyond. So with that, I'm going to pass it on to our speakers.
Thank you so much for having us here. We are honored to be able to share a little bit about our work and being community with everyone here. We're going to start by going through a presentation on the process of how this collaboration came to be, and then we're going to screen the short film and then open it up for Q&A. So the title of our presentation is Stories of Black Motherhood, using storytelling to connect, to heal, and transform. And that has always been the mission of this collaboration. Fatima, do you want to go?
Absolutely. Thanks, Dr. Little. I get to say Dr. Little now. Tariana and I have been friends, and I've seen the transition from just saying Tariana to Dr. Little, so I want to honor that. Again, like Tariana said, I'm so grateful to be in your presence today and for having us. As I was already introduced, I do a lot of work related to equity and justice, and part of my passion work is around storytelling, what it looks like, specifically when we're talking about health inequities. And so Tariana and I met while I was in grad school working on a project because I was sort of tired of sitting in the classroom hearing a lot about Black mothers, Black women, Black birthing people dying, and not necessarily hearing the full story. As someone who identifies as Black and coming from an immigrant household, I knew that there was something missing, right? Like, I know my mom has struggled coming to this country, and there's also a lot of memories of joy, of love. And my question was always, how do we do more with the data that's out there? What would it look like to connect storytelling to that? And so I was introduced to Dr. Little at the time because of the work Dr. Little was already doing, and it just made perfect sense for us to collaborate.
And I remember that, lunch meeting that we had, and Fatima came to me and said, "Hey, I have this project," and she came with a binder. She was super prepared, a lot of paperwork, a lot of documentation, very formal. And I'm like, I get what you're doing. I'm biracial. My mother's Black. I understand where you're coming from. And we didn't have to go through any formalities. It was just an understanding of, you have this frustration with the data that you are inundated with that doesn't tell the whole story. And I happen to have a platform where we tell organic social impact stories. So let's collaborate. And it was a match made in heaven. And so the process and the framework, if you want to speak on that, Fatima.
Absolutely. I mean, every time we talk about how we met, we literally just gave y'all like the shorter version because we know we're short on time. But it has been amazing. And that's one piece of doing this work together in community. Because when we think about the process, while I was at BU, the question was, how are we talking about reproductive justice? Is it just a theory, or should we be thinking about this more about in terms of practice? How do we put this into practice? And so this framework has really been a backdrop for me in all the things that I do, because while it's a term that was coined or at least widely associated with Loretta Ross, who's considered a feminist scholar, it's a terminology or at least a concept that isn't new. And this framework sits upon three tenets, and that's the right to have a child, the right not to have a child, and the right to raise your child in a safe and healthy environment. When we think about what these tenets might look like or mean, we're also thinking about our structures and our systems. I grew up in a community, in a household where, where my mom is from, they would say, in order for you to know the worth of a country or a community, look at the way they're treating the mothers and the children. And so very often our social constructs give us an idea of what's happening in our communities. And as I was studying Black maternal child health work and looking at those inequities, really wanted to focus on that third tenet, because very often we have those conversations on the first two, but what does it mean to talk about structures and systems that allow us to raise our children in safe and healthy environments? And so using this framework and then connecting with Tariana, we then started thinking about what does storytelling look like, recognizing that storytelling is very much part of this framework, because how do you know when someone has a right or doesn't have a right and or has the ability to raise their children in a healthy environment? And so, a really quick quote from this book, and if folks are familiar with this, hopefully you're smiling from ear to ear. But I just want to quickly highlight a quote from page 59 in this book. Storytelling is an act of subversion and resistance. Stories help us understand how others think and make decisions. They help us understand our human rights and the human rights of others, which are protected or sometimes violated. Storytelling is a core aspect of reproductive justice practice because attending to someone else's story invites us to shift the lens. That is, to imagine the life of another person and to re examine our own realities and reimagine our own possibilities. So it's not just hearing what someone is going through or what their experiences are, but also using that as an opportunity to reimagine what if, what are the possibilities, and what action steps can we make or take and or change in order to create better futures.
And this framework with reproductive justice and the storytelling within that is it aligns a lot with the orientation that Envision Productions, that my agency has towards storytelling. We created our own framework called social impact storytelling, and it's based on three tenets. One is real people, real stories. And we focus on that because we know from science and psychology that numbers don't move people, narratives do. We're not compelled to act because of statistics, but rather stories. And so we try to focus on real people talking about their lived experience. The second pillar is centering those most affected. We believe that those that are most impacted by a problem are the experts in that problem and also the experts in the solution. So let's give them a platform to share their truth. Oftentimes, these stories and the content that we put forth is of people that have been marginalized or vulnerable or in some way invisible or unheard. And through storytelling and media, we're able to give them a platform to share what they have to teach us and to tell us about their experience and the world. And lastly, it's conveying impact. And it's getting at our human need, the way that our brains work, of wanting to know the resolution, the ending of something. So conveying what has been the impact of a program or an initiative, and conveying like what is the difference that has been made on individuals, on families, on communities, and then society. So in terms of putting this out into the world and going from a conversation at a restaurant to actually a call out into the community, we worked on a really short social media campaign, and it wasn't even that like huge. It was like very focused and targeted and accessible. my background is in health communications. And so from a perspective of conveying the goal of this project, it was super important that the language be an everyday language, that we don't lead as an institution or some sort of research study, having these like power dynamics and language that can be really inaccessible and sometimes exploitative and damaging to people. So, really clear language, like voices of Black mothers, already centering who we're focusing on, and then a call to action, share your story, really simple description of a storytelling project to explore how race and other social factors impact Black motherhood. And then what is the goal, right? Sharing your stories about your experiences. We hope to spark conversations, educate our community, and share supports. Why are we, aiming to hear from you? And then really going into some of the negativity, but from a place of empowerment, right? So we want to hear from you because your, statistics tell us more likely to die during childbirth, have a premature baby, regardless of income, education. And then, we want to use that to be able to spark conversations and to really share these stories. And then really being clear about how the stories are going to be shared. This is super important because we didn't want to be exploitative in any way. We didn't want to say we're going to, get your information, then you're never going to hear from us. You don't even know where it's going to be shared. So we were really intentional about saying it's going to be shared with the community and school settings, social media, and on our website. And we've still kept that commitment and that transparency. And then also understanding that within the Black community, we're a diaspora. So, making sure that we encapsulate African-American, Black, African Caribbean, and Afro-Latina women, and then having Fatima be the point person, and if you want to speak on the process of interviewing mothers for the story.
For sure. Thanks, Dr. Little. And really want to emphasize what Dr. Little just said around this idea of who owns stories, right? Who owns narratives. And even if it's not the intention for research to make it feel like there's almost like a dark, heavy cloud upon the Black race, to be quite honest, it is the feeling that many people have when you're doing this work, whether you're talking about maternal child health or you're talking about anything related to equity or social justice, right? And so thinking about the questions that we're asking is just as important as to what people are answering, right? Because we won't get a full breadth of answers if our questions are very limited. And so this process was very open. While we put a few things around criteria, we wanted folks to understand that it's whatever they want to share based off of the research that we put here on this flyer. And I had an opportunity to interview over 30 plus parents who were in the Boston area. We talked on the phone, and some we were able to meet in person. But as you can see, it's been about 3 years now since we did this. And in that moment, I realized that a lot of the people who shared their stories weren't just sharing their stories because they wanted to be part of this short film or project. A lot of them on that call or on that phone was telling me, this is the first time I've ever talked to anyone about my birthing experience. This is the first time I ever talked to someone about parenting, because sometimes we don't talk about it. We just assume that, hey, this is what we're supposed to do. This is what my parents did, my community members did. And so them just talking to me was almost therapeutic. And that was one of the findings. But another piece of this was recognizing that there were so many commonalities, so many themes that came up, which you will see next in the video once we get to it, just to show how even when we think about different aspects of our lives, whether it's education, class, our access to healthcare or lack thereof, we see that race, specifically racism, is a key indicator when it comes to outcome, and it directly impacts what we have access to and what we don't have access to. And so this experience, while we weren't able to highlight all of the stories, we only were able to highlight 3 of the stories. What I want to also offer before you watch the short film is that there are so many other voices that are part of that I heard, that hopefully will resonate with you as we go to that part. Anything else you want to add, Dr. Little?
Every time you call me Dr. Little, I get very it's still new to
Okay,
me.
I'll stop.
It feels like you're making fun of me. So here's some of the themes, the larger themes of the mini doc. It was about pregnancy and healthcare experiences. moments of interaction with staff and interaction, with the larger healthcare system and what they needed and what they didn't need and what they got and what they didn't get. Then the joys of being a mom. This is super important because oftentimes when you see information on Black motherhood, it tends to be from a framework of deficiency or lack or, sadness and pain. And we did not want to recreate that. We wanted it to be a lens of joy and of hope and thinking about the future. What hopes do you have for your child, for your family? So really centering a different perspective on a community that otherwise, when we look at, the data and who's telling the data, it tends to be out of our control and only about a certain specific experience. And then here's some press and next steps. So, we have shown the short film at school settings, at conferences. It's been viewed locally all the way to internationally, been covered by the press. It has had a life of its own in ways that we never imagined. We thought it was going to be, a capstone project for a master's degree and maybe some community screenings, but really it's gotten a much wider reach. And I think it speaks to just how it resonates, that it's real and it's beautiful, it's well done, and it's something that sparks conversation, it hits people. And here's our social media if you guys want to follow more of our work. Anything that I missed?
No, we just know that we to be honest with you all, we're not even capturing just even recent and current, data around press. Like people continue to reach out to both of us. Which is why we're here today, right? But just thinking about how this is also being used right now in academia. So there are a lot of folks who are within the OBGYN department who are now using this as part of their curriculum because it's something that they want to see. In the work that I do, and just as a facilitator and working with companies and even healthcare settings, this is being shown to doctors within hospitals. So even though we wanted this to specifically be for our people, part of this is also institutions and systems using this as well to understand that it's not just coming in, so a patient coming in and you automatically tell them what they need, but also part of understanding who that person is next to you is understanding their story. So that's the only other thing I wanted to add before you switch screens.
Thank you. And then lastly, just thank you for hearing us present on the framework, on the process of how this baby came to be. And so, beautiful pictures of our moms and us. And now we're going to screen the film and then have a Q&A.
Awesome. Thanks, Dr. Little. And as she's switching, one thing I want to highlight is Dr. Little herself is an amazing human who has carried another human. So within this project, Dr. Little is also a mother, and part of what I have been trying to do, which I've taken almost a year off of this, but continuing to highlight these stories. So what would it look like to do this on social media, especially because of COVID, to highlight pictures and images, which you'll find on the Instagram handle shifting_narratives. So if that's something that you're interested, or folks who would be interested in sharing their own stories, feel free to reach out and or ask questions.
Thank you for mentioning that, because the last time we screened this, I was pregnant and you didn't quite know it, but you guessed it. And now I had the baby. So this is my first time watching the film, since giving birth.
What I like most about being a mother, I think, is being able to be in partnership with a tiny human. And that can be both really challenging and really inspiring. And I think that there are these moments, big and small, that come up at all unexpected times that help me think about, what does it mean to grow and to develop and then to be nurtured, both for him and for myself.
I can live my whole life worrying about what other people are bringing to the table to oppress her. Or I can spend a whole hell of a lot of time loving her, nurturing her, valuing her life, and showing her that she is not only meant to be here and she is as equal as everybody else, is to show her her assets.
My daughter's biracial. And so that's a whole other thing for me. Like, I don't know how to teach her to be biracial in this society. I only know how to teach her how to be a Black girl. And in our society, being Black is not a good thing. Kids as young as 3 recognize race and racial differences. It's up to us as parents to give them context.
As a woman of color, when you are at the hospital, often you feel a bias.
Going back and forth with all of the nurses, one of them came in and was like, saw my husband and was like, oh, she's gonna have beautiful curly hair. And I was just like, oh, I don't want her again, and just, I was banning nurses left and right. It was my only saving grace was that my OBGYN was Black and understood. She understood that I was under more stress than the other white people women that were on the floor. She understood that I needed injections of Blackness. She came by with poems and songs, and she just sat and talked with me. There is something really powerful about a well-placed girl. Like, that is, as soon as she said that, I was like, oh, okay. I'm in a space that, like, I can be all of me, right?
There's just too many layers of this that I have to fight through to get the person on the other end to look at me as a human being. So yes, I say race, but then I also say, I think another thing that contributed was class. Maybe if I'd walked in as an attorney, as a Black attorney, the treatment would be a little different. But I walk in as a single mom, right? No partner, I'm sick. And the only thing I can think is either I get really sucky insurance and you determine how you're gonna treat me based on my insurance, or what else could it be? Because there are other women that come here and they walk out a lot happier than me.
Other challenges that I've had since my son has been born have been around issues of equity as related to education. And I think that what I've really tried to do is to make sure that he is in a place that's going to nurture him, that's going to encourage him to be free, that will instill a really strong sense of racial identity. And those places are not sort of everywhere.
With We the People, we educate little kids to do work around equity and social justice. And a lot of parents are like, whoa, wait a minute, my child should not know this, They have the luxury of their kids being in a bubble, and I don't have that luxury. There's a fear, right? it's a double fear, right? I don't have a Black son, and that's a totally different fear. But the other fear is that like I am scared walking down the street and seeing, with my daughter and seeing the police, There's a real feeling of fear for that. It's not because of what can happen to me, but what happens to her, right? Like, she can grow up without a mom.
I overly hug her, I overly kiss her on purpose. So at this point, she's kind of like, can you not so much, not so much. I'm like, okay, so if you feel like you're filled up enough, then you're not going to be looking for it out there. So my relationship with my daughter is about everything that we've encountered. We've done it together.
I think that what we have to do, all moms have to do, Black moms have to do regardless, is we got to build coalitions. And so we got to share resources, we got to talk to each other. And as much as I'm, again, devoted and dedicated to the outcomes for my child, I will turn right around and fight for my neighbor and for other Black kids too. My child's future is as connected to other Black kids' futures as anyone else's, and I'm as responsible for them as I am for him.
When you look at your child and you see love, you look at another child and you see love. And that is the real bridge.
I want her to be free. I want her to be able to walk down the street, not move out of anyone's way, and be able to say whatever's on her mind without being labeled. I want somebody to be able to say, wow, you're so articulate, without it having something else behind it.
So I think my hopes and dreams for my son would be, first, that he is free and that he emerges into adulthood, one, alive, two, whole and happy.
A lot of what I do is absolutely intentional because I also know what it's like to be a young woman myself. And the one thing I couldn't have is my child out there needing someone else, when I want to hope that I'm all of what she needs, and everything else is because she wants it.
We went in at 2 p.m. who was expected to do a routine schedule.
Awesome. Thanks so much, Dr. Little, for sharing that. As we said, we would love for questions or comments and reactions for our last, I think, couple minutes together. I'm also going to share a link of a follow-up video that Envision and I worked on with the mothers, because this past Mother's Day, we wanted to catch up with them and also just wanted to see, with COVID happening, what's happening. So if that's something that you're interested in checking out, I put that link in the chat. So I'll stop talking.
Yeah. Hi, everyone. I'm Kelechi Afor, senior at Tufts University, also on the conference committee. I just wanted to thank you, Dr. Little and Fatima, for sharing your story, well, your film on Black Motherhood. We'll now transition into any questions we have for our Q&A session. So please submit any questions you have with the Q&A button, and we'll get to as many as we can within like the next 5 minutes. One question we have was, have you all thought about doing something similar with teenage mothers and highlighting what their experience was like?
We have never gotten that question before. And that is an exciting and I think worthwhile pursuit, because you have a completely different experience in terms of social expectations, social treatment, but also what are the experiences and hopes and dreams and perspective of young mothers.
Yeah, and thank you for that. And to add to that, I think when we did the call, while we made it open, I think there is stigma. There's a lot of stigma around teenage pregnancy. And so I also wonder what it would mean or look like to be very intentional, so that teenage mothers feel like, hey, no, we specifically are looking for you, versus putting that motherhood experience. Because I know a lot of people we spoke with, some people would be like, well, I'm 63, my kids are like in their 30s, do I count, right? And so a lot of times when people hear this, they think someone who just gave birth or is currently pregnant. So I appreciate that question.
Another question we have was, what were some challenges or barriers that you faced in pursuing this project?
Great question. I see that Dr. Little looking up. I mean, how do you capture all of that? I would say there was so much. I mean, this could have been a documentary. That is a follow-up question we've gotten, to say, like, could you do a documentary on this? But imagine interviewing 30 people and all of their stories being highlighted. I think that was the challenge in trying to figure out, every bit is important, and what pieces do you capture and share and make public? And not to say that the other isn't important, but how do you take so much information and make it close enough or short enough? Because most people are on Instagram, social media now, and you're used to like the 2 minute videos or the reels and TikToks. And so the longer it is, sometimes the harder it is. So trying to find that balance in this day and age can be a challenge.
And to follow up on that, on our team, for Envision, so it's me, I lead the agency, and then we have a white immigrant who's my partner, and then we have a Turkish immigrant. So he is a man of color. And so you have these two men that are doing the filming, and so getting their perspective and sort of hearing how they're journeying, right, and their own growth journey, learning about women's experiences, Black women's experiences. And then just, when it comes to editing, just having that perspective with Fatima and me, just being, able to say, hey, this one is important, right? Or this point has to be highlighted, and maybe they don't understand why. And so that's a moment to educate them. For the most part, it was a smooth process, but, they are who they are, they are men and from different countries, and have been minoritized and racialized in different ways. And so I know for our team that it was also a growth experience for them.
We have some attendees who are interested and curious to know if any OBs have watched this film and their reactions having seen the film.
Yeah, I've come across a few. So in the work that I do, I've been able to facilitate a few trainings where I've shown this film. And it's still shocking, right? So folks have been in OB for a while, and it's like, wow. And then for folks who are Black and mothers and identify as OBs, it isn't shocking. And it's like, thank you for bringing this voice and this narrative so that we can train soon to be OBs. And I think part of it is also the bias part, where none of us want to accept that we have bias. So I think the training that I have, in addition to bringing this film, helping everyone understand that we all have bias, whether we are marginalized or not. Because what better, when people say we're all swimming in the same water. So some of us have even internalized some of these negative and harmful messages about ourselves. And so it's been a mix of reactions for sure, depending on people's identities and so forth.
And then for our last question, someone would like to know if you would be open to collaborating with perinatal psychologists in future narratives.
If there are people here that want to seriously collaborate and you have a need, you have an opportunity, we are more than open. It's a beauty to see this mini doc baby have a life of its own and inspire other people to want to contribute to larger stories and to different perspectives. So we're fully open. And I will put my email in the chat.
Awesome. Thank you so much. And thank you, attendees. And we look forward to seeing you in the next sessions available.
Thank you, everyone.
Thank you, everyone.